Hi, this is Dr. Mohebi from Mohebi Hair Restoration. I would like to share some of the consultation I've seen today, some of the follow-ups from previous hair transplants. Young gentleman who came to us with class 3/4 hair loss. These are different angles. The front was almost gone. The sides and the mid front is pretty thin. Here with 1700 grafts, which is a reasonably small number of grafts, and he has a hairline now. Different view, very natural looking hair, and reasonable coverage in front. There's pictures from before procedure to after. This is almost 1 year after. Before and after. Maybe because he want to have the temporal points filled. The temporal points are very important in the youth of the face. As you can see here, you can frame your face. Wanting to not only add those temporal points, but add a little bit more density to the mid front and a little bit behind the initially transplanted areas. You need more than one hair transplant to get full density and full coverage of the transplanted area, and this is more common in people with fine hair. Hair shafts are the more volume you can create with the same number of grafts in one procedure. Sometimes I tell people who have fine hair up front that they most likely need more than one hair transplant if they want to have the most solid hairline. Who had a FUE procedure to fill the front and corners, and these are the pictures right after his procedure. Pictures from today, right, like 2 weeks after procedure. It's almost looking perfect. They get different size, a little bit redness is still in the scalp, no sign of hair loss. 2 weeks after procedure is a perfect time to see the almost final result of the procedure. Although these hairs are going to be falling, usually 90% of the cases, after the 2 or 3 weeks from surgery, the hair is falling. Patients start growing hair after 3 or 4 months after procedure. Patients that came to us for 12 months follow-up. Of course, these are the pictures from before the transplant he had with us. Frontal view. He had 2 procedures before that unfortunately could not create the kind of density and fullness that he need to have. This is the schematic of the areas that we transplanted here. He got 17 grafts that almost 1500 of it or 100 of it was placed in the frontal area, and the remaining was placed on the crown. How he looks 12 months after procedure. Very solid hairline. Natural looking. Another angle, the top view. Of course, on the top he still can use some hair in the future. View here, so this is pretty good compared to what he was before, where he was before. For a similar case that we showed you last 2 weeks ago, that a young lady had a masculine hairline. This is design. We not only fill the corners, we are creating the humps that some people can really benefit from those. This is a feminine hairline compared to she has, and it's going all the way back. Makes it like a man forehead. Reasonably small number of grafts, we can create a huge difference in framing the face better and making it more feminine and more refined. Look at the schedule and see what we have on our calendar for this week. We have all FUE cases. The 2000 FUE grafts to restore hairline, front and crown. Continuing with 3500 mega session in 2 days and 100 FUE transplants on pretty hair loss picture of the week.